This episode of the ABIC podcast is brought to you by Cynosure Australia. Hello and welcome to the ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we're strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is the ABIC podcast. I'm your host, Stephanie Miller, and today's guest is Dr. Feng Yang from Melbourne Clinical Laser on behalf of Cynosure Australia. Dr. Yang boasts over 3 decades of extensive experience in general medicine, surgery, and cosmetic medicine. He honed his skills at the Beijing Medical University before embarking on a surgical fellowship at the Alfred Hospital in 1994, which marked the beginning of his illustrious medical journey in Melbourne. In recognition of his expertise and dedication, Dr. Yang was awarded the Fellowship of the Royal Australian College of General Practitioners in 2002. With a steadfast commitment to advancing patient care, Dr. Yang has been at the forefront of cosmetic medicine for over a decade, offering cosmetic injection services to a diverse clientele, and having managed thousands of cases, his proficiency is unmatched in the field. Continuing to innovate and elevate standards, Dr. Yang has expanded his repertoire to include cutting-edge laser and equipment-based cosmetic services, which has enhanced his service and patient satisfaction. Dr. Yang's unwavering dedication to excellence ensures that patients receive the highest quality care, tailored to their unique needs and aspirations. Join us for a patient consulting masterclass for skin rejuvenation. For Cynosure Australia, today we welcome Dr. Feng Yang. Welcome to the podcast, Dr. Feng Yang. How are you today?
Good. Thank you to invite me.
Yes, it's such a pleasure having you. And we have got such an exciting podcast today. We're talking about all things consultation. And if you own a clinic or a salon and you're listening out there, this one is a podcast not to miss. So, Dr. Yang, you have a very interesting story about how you came into the aesthetic industry. Tell us about yourself and all about your journey.
Well, I left medical school 37 years ago, so quite senior general practitioner. And I went through general practice training in the late 90s and started my own clinic in 2002 in CBD Melbourne. Just like a lot of general practitioner, I ran the clinic and we got a team of 3 doctors. We work together. And more than 10 years ago, when the injectables first become popular, so I participate in a lot of trainings. I find it's quite interesting, and I enjoy the process. So I start before all the devices become a part-time injector, and those popular brand, I've been doing that. And after a while, when the devices become popular, and a lot of device companies start to approach me, and Cynosure was the very, how would I say, exceptional one.
Yeah.
And the CEO coming to see me to say, Feng, are you ready yet? We've spoken about all the devices. And I read through their things before. So on that day, and we had a good chat. And then I finally decided we're going to start with 3 devices.
Wow.
We started 7 years ago with the PicoShow laser. Back then wasn't as popular. And we had sculpture and pavé, and I operated those devices in my clinic, and for 2.5 years to 3 years, I find it was quite rewarding and it's very popular, and we did well in those 3 years. And then 5 years ago, just about 5 years ago, 2019, and I decided I want to really expanding. So I bought another 3 picoshore, and
Wow.
also multi-platform devices. So I opened another 3 clinics. So I got 4 clinics at the same time, 2019. Looking back, I must be a genius to choose the time, because 2020, we all know that
I was about to say.
we all
Goodness
had
me.
lockdown in history. So that's one thing I want to show everyone. And today I still run 3 clinics, and one of the clinic, because they had a major renovation of the shopping center, so temporarily closed it. And the other 3 is running well. And even with all this, like the hiccups we have, in Melbourne, everyone know, we had more than 280 days of lockdown.
Wow.
And we survived. And now I got 5 full-time Division 1 nurses working with me. And some of my GPs participate part-time. And yeah, we got a great clinic and fantastic team, and I really enjoyed it on top of my general practice. Yeah.
We certainly are very experienced, and oh my goodness, how you pulled through opening up, a few new clinics right before the lockdown is that's a story for another time, but that could be a whole podcast in of itself. Cynosure have a unique relationship with ABIC. They are foundation members of ABIC and great supporters of the industry. If it wasn't for foundation members like Cynosure and all the rest of the wonderful supporters that we have, ABIC wouldn't have come into existence. So we'd love to thank Cynosure, you and Cynosure on behalf of the industry, to support such a great organization such as ABIC, who's furthering the elevation of our industry. But they've told me in many meetings that we've had that you are the master of the consultation, the skin consultation. You have a unique process. We'd love to talk about that today so we can learn from you. But before we start, let's start by outlining what exactly are the concerns that you're seeing, the most common ones in your patients that are visiting you for skin rejuvenation consultations.
I think it's quite unique experience for me to transform from a medical consultation to a cosmetic-oriented consultation. I think at the very beginning, a lot of doctors, you would treat the whole process like a medical consultation. And soon I find out it's actually not totally true. And if you want to service your patient well, you shouldn't treat this as totally medical. And in medical, being a doctor for more than 3 decades, I have a lot of experiences in dealing with different conditions and try to resolve the problem or try to enhance the health result. But cosmetic is quite unique, and this is why I want to emphasize with a lot of professionals. Patients come in, they may have an issue, then they may worry about some part of their appearances, like pigmentations, like wrinkles. But a lot of people come in, they have an attitude of enhancement, and it doesn't mean they have anything wrong. It's like someone come in, I feel perfectly comfortable, but how can I look better? So there's a few things you need to look into this. Like even with the pigmented lesion, if you purely concentrate on the lesion and you forgot about the general appearance, you won't be as successful as you would be. So you need to tell your patient or try to exchange the information to get the conclusion to say what you really get out of this, either treatment or medication or method or using devices, is you want to enhance your appearance. Like people look at you as a person and they just say you look better, more energetic, as a more, from authentic point of view, you look much better, or you have more confidence about yourself. So if you emphasize on that, then the issue become part of it rather than the only issue. So I find that it's quite well received, if you like, by my patient. So a lot of my patient is here for rejuvenation, enhancement, rather than they got a disease, they want you to fix the problem.
I love the word that you said, more energetic. Can I ask, do you see a difference in your patients' energy levels, zest for life, mental attitude after having enhancements and feeling good about the way they look?
Of course. And you see this all the time. And I have people come in, say thanks to me because they think they are more confident, they got improvement or better off positions in their career path. They believe they are more confident about their personal relationship, and a lot of time, more than often, they dragged their mother in, their boyfriend, their husband, because they just think they enjoy so much about the benefits. So, and cosmetic is not about movie stars anymore. It's part of average people need, like you and me. And I keep telling my patient that a few hundred years ago, probably we don't even have a professional haircutters, right? The hair, yeah, it's every one of us would, cut our hair at home, other than exceptional a few. And these days, we all need it. Even in pandemic, it's classified as so essential, it can't be closing down.
Yes.
I think cosmetic, in a way, it's getting there. It's become a modern tech the average people can enjoy. And eventually, I think it will become, so popular that most of the population will enjoy it one way or another. And there's still a slice of stigma about cosmetic service, including all devices and injectables and this and that. And no one feel embarrassed about doing their hair. Why should you feel embarrassed about enhancing your appearance?
Absolutely. And the reason that I ask is because there are still, as you said, there's a stigma, and there are still people out there, and not just people, but even government bodies and, regulators and things like that, that have claimed that there is no real connection between looking after yourself cosmetically, enhancing and refreshing yourself, and your mental health or your well-being, or anything like that. For example, reflecting on your the way that you feel physically. And I think a lot of people in our industry would challenge that, to say, actually, we have seen anecdotally, and we have seen in general, that it does have a wonderful effect on people's quality of life, energy levels, relationships, and mental health. And it's sad that people still think that it doesn't.
Well, the misconception, it's like a lot of things in our life, it takes time to go away. And even it takes myself a few years to be able to have a more close to real attitude on the service I'm offering. Because at the very beginning, when I first started, that was more than 15 years ago, I must admit, at the very beginning, I was hesitant in doing a lot of things because the traditional wisdom was that, the injection and for purely just enhancement And is that justified medically? I sometimes joking with my patient, I believe what I'm saying is true, and the anti-wrinkle injection is the best tested medicine in the world. I said, just as safe as penicillin. And some of my patients ask me why. I said, if more than a few million people have the same medicine around the world every year, if not more, I believe it will be tens of millions, because as an average doctor, the injection I'm doing, it was hundreds, right? So if you rationalize around the world, it must be tens of millions injection happening every year. There was never any serious complications other than a few misused cases, overdose or whatever reaction, and is pretty much very safe. So if you use something for millions of people every year for decades, and you can't argue it's not safe, right? So so that's the truth. We are here. We have to tell the patient the truth. When you use medical grade treatment or devices or medication, and obviously you got to use it the right way and with precautions, and to reach the result without or minimize any potential side effect.
Wonderfully said. Let's move on to the consultation process. As we said, you've got a wonderfully special way of doing it. Can you tell us a little bit about the structure of your consultation, and also what's the most effective types of communication strategies you have for patients, for them to understand, appreciate the journey of cosmetics and aesthetics for them personally?
I think the first thing is you need to find out why patient is here. And some people come in with a particular concern. And some of them say, I really don't like the wrinkle. I want to improve my skin texture, or I want to resolve the pigmented lesion or patches or spot. And obviously the conversation starts from there. Ultimately, they come in to talking about enhancement on their appearance. If you start your conversation with that spot, though you can expand it into other area, I think the whole situation you need to consider about is how much the patient want to deal with it. It's like a medical consultation. Some of the things is the patient didn't realize what they can do or what they need to do to address the issue. So you need to guide them. You need to give them more understanding around the issues. And then you can expand a little bit on top of that. And then normally they come in with more than one concern. So if you start with pigmented patch or spot, and they will say, oh, actually, I'm worried about the wrinkle. I want to enhance my jaw lines. I want to improve my skin texture. So we can then talk about availability and what can be achieved, what is not a reality. So also another important thing is you need to communicate to get the sense that what patient's intention, all right, and to give them a picture about how much they can achieve. And financial aspect is also quite important, right? I never encourage patient to go borrow money to do anything. Financially, be sensible is also big part of the consultation, because then they feel more comfortable and they are probably happier about what they can achieve. Because if they underlive the financial pressure, even the appearance is enhanced quite a bit, psychologically may not be the best for them. So probably compare with general practice, you need to be a little bit more aware in that aspect, because patients normally have to allocate more resources than the general consultation.
when you're talking, I get a picture that you structure your consultations in more a holistic type manner, in a more global type sense. When you seeing the patient, if they're coming and presenting with a spot, they will then talk about their wrinkles. Do you assess the patient in that holistic manner, or do you just focus on the exact concern that the patient has and focus on that rather than looking at the overall appearance and giving suggestions on that?
You obviously try to do a comprehensive assessment and try to base your consultation on that. But the patient is a priority, yeah? So in the consultation, you will sense that how much the patient want to talk about anything beyond what he or she is concerned. Sometimes patient only want to communicate about the particular thing, and then you would concentrate more on that rather than expand your topic to other areas. So I guess the particular skills based on the experience you gain along the years, how to deal with people. I think it's like you meet with someone, you have a common topic, and if you're a footy lover, then you, someone you never know, and you sit in a train, and you may start to talk about the star you both like or you dislike, or whatever. And so I think conversation, consultation, in a way, is based on that. So you need to sense about what you can give in that consultation. You try to encourage them to do what you think will benefit them most, what is achievable, what psychologically will make them more sound or enhance their day-to-day mental status in a lot of way, and address what is well-respected idea by the mainstream medical profession, or some of them are beyond that, to say the least, unachievable or not well supported by the scientific data. So you need to firmly express your opinion. So hopefully they can get something out of it, because other than medicine, I think the consumers, the customers, the clients, I never try to call them as my patient. I try to correct myself. Even in general practice, I think patient is a very old term. I try not to call my patient.
I like that. I'm hearing people calling their clients guests, clients, or customers, or something like that rather than patient.
Yeah.
You find that term is becoming a little bit outdated?
Yeah, I believe so. Yeah.
Well, I think it does establish a different relationship if you're calling them your guest or your client. It does imply that usually a patient implies that they're unwell or they're seeking treatment for a problem. And I do think it changes the dynamic a little bit, and possibly how you're interacting with that particular client. Do you find that some of your clients come in with underlying fears or apprehensions about having procedures or having rejuvenation done? And what are some of the trust building things that you can do to help patients and clients overcome these fears and anxieties they have?
I think it's from knowledge and experience. It's like medical treatment, and you have a little bit worry or mild anxiety. I'm talking from my own experience. Being a doctor for 30 years or more than 30 years, sometimes I go have a small procedure done, even like ultrasound, CT scan, or I had a few years ago, I had, like endoscopy exam. And I must admit, I have a little bit of anxiety, before I be put down in we call sedation, and some of the listeners will call it general anesthetic. You can say it's a mini general anesthetic. But even when I went through that, I must admit I have a little bit of anxiety. So if I, as a doctor for more than 30 years, and when a lot of this similar procedure, I have a little bit anxiety, then the patient will probably most likely have the similar, if not more.
Leaders, innovators, developers, and best-in-class creators of energy-based aesthetic and medical treatment systems, Cynosure develops and manufactures a diverse range of leading treatment applications for hair removal, tattoo removal, skin revitalization, scar reduction, women's health, body contouring, and more. Always one step ahead of the industry, their innovative products are used by practitioners, physicians, and aesthetic business owners worldwide to enhance their offerings and provide cutting-edge treatments for their patients. In addition to laser and RF technologies, Cynosure Australia also provides marketing, clinical and technical support services. Learn how Cynosure Australia can help you grow and succeed. Contact the team at www.cynosureaustralia.com today.
I met with a lot of people who starting out any cosmetic treatment, either it's injectables, either it's device treatment, because the perception out there would be, oh, it's associated with a lot of pain. Like a lot of medical treatment, if it's been used inappropriately, accident or severe side effect can happen. So obviously, you would try to enhance their knowledge and to try to reduce any misconception about any particular treatment and encourage them to learn more and also encourage them to do some basic stuff, some minimal risk stuff. Start with small baby steps. So I think it's like everything, you know, when you're scared of something, you try to start with small and then you gradually easing it into it. Once they have a few simple procedures or treatment, then they feel much at ease and feel more comfortable. So I actually enjoy the consultation with a lot of new clients and about how to start their journey treatment. I do this almost every day. So once they're into it, and then you can talk with them about other availability and other alternative treatment to do more for them. And then for them to gradually really from scare and phobia or anxiety and to a certain extent to really enjoy the process and be more confident about those services.
It must be so satisfying taking them on that journey from, you know, them first arriving and having those fears and anxieties and not knowing what to expect to giving them that education and then seeing them, you know, flourish and keep going with various different treatments. Speaking about education though, how important do you feel education is in the practitioner journey and specifically relating to patient and client consultations, and also managing expectations and ensuring that that patient has informed consent or decision-making in that process?
In that aspect, it's quite similar to medicine. So I teach a medical student from Melbourne University. I've been doing the teaching for the last 10 years. So every few weeks, I would have a new student. I normally discuss a term I believe invented by myself. It's called negotiation medicine.
Oh, I like that.
Yeah, and what that means is that we are different compared with a normal educator in a university or in high school or even elementary school, because people who walk in all have different education background, ethnicity, age, and quite dynamic. Their way of view things can be quite different. Right? Their level of understanding particular treatment and previous knowledge level is also different. And you need to quickly sense that the information you can deliver and be effective on that. So you need to adapt to that. You need to schedule that. So the more you adapt to that condition, the more you can deliver. And the patient, or in cosmetic, the client, can enjoy it well, being cooperate with you. Because general practice and also the cosmetic service are quite different compared with a hospital. In a hospital, patient in a different scenario, they sort of passively accept a lot of things, right? And they can't run away from the doctors, from the industrial environment. And they are willing psychologically to accept a lot of sort of short-term treatment. But in general practice scenario and in cosmetic consultation and services, patients are in the position of driver. So they need to be convinced they're here to be in the position quite equal with any practitioners or service providers. So you need to be aware of that. For deliver that service most effectively, you need to negotiate with all the scenario and the level of understanding, the level of willingness to participate in the services. Without the cooperation of your client, everything is zero. So it's testing the provider's ability to deliver the service with the cooperation of your client. For a doctor, we spend a long time in the hospital scenario to be trained. So you tend to get this subconscious philosophy or attitude that you are in the driver's seat, you can deliver when you feel appropriate. In a community, that's not the case. In cosmetic, it's definitely not the case. So you need to be in the position that you need to win your patient over to cooperate, benefit them. So that's how I look at the whole thing.
I love that. Do you have any negotiation tactics that you want to share with us, or some things that you personally do? Is it about listening? Is it about responding? What is the trick?
Listening is obviously very important. You need to listen to the patient, what it is concerned. Along the years, I learned there's two things. Never dismiss your patient, right? We all have some, I call it pre-deposit knowledge and attitude in our life. We do, when we view a patient coming, I think, oh, he's here just want a medical certificate. And he's here, I don't know, maybe he's not genuine. But I learned quite a lot along my way that you never dismiss your patient. Not only listen, you hear. And the English word, when I first started learning English, I always struggling in my elementary school that what's here? Listen. You need to hear. Yeah. You need to understand the message behind. So I'm genuine trying to understand the message. That's number one. And number two is telling the truth, right? Be genuine, really genuine to your patient. I think most people like that. Even they don't select you as their service provider, it makes you feel good. And it makes them, I think, feel good too. They're more comfortable with you. So I think if you ask me why my team and myself able to sustain this long, right? I think that's part of my trick.
I love that, about listening and then telling the truth, and maybe all of us here thought you were going to say something about persuasion or about sales tactics, but you haven't gone there. You've just gone with complete patient care. So making the patient the center of your consultation process sounds like that's the key to what you do.
Exactly right.
There are a lot of practitioners out there just starting out, or those that are sort of midway through their career that are struggling with the patient consultation, because it is always, I think, the most in-depth and most complicated sometimes part of the client journey when you're starting off. What advice would you give to practitioners looking to learn the consultation process, or how would they enhance their skills? in that area?
I think the change starts from the service provider. Either you're a nurse or you're a doctor or you're a therapist. And I think the balance between the clients and the service providers is a little bit different compared with a doctor and a patient traditional relationship, because the balance is weighing into more equal. And in medicine, I think the balance and the traditional wisdom is the patient will follow your instruction. At least in that consultation, they will. In general practice or in other aspect of medicine, patient in that consultation will express their willingness to cooperate. So that's the thing. You should feel more comfortable about a more balanced position into that conversation and be a real advisor rather than even an educator, right? We just spoke about education. In theory, that's probably somewhat true, but in reality, how you view that, I think it should be changed. You more become an advisor role rather than even educator, even in a sort of more stronger, if you like, position. You are not. And especially the modern day clients, they're more confident and they do research. They do learn a lot of knowledge. Sometimes they surprise you. They learn some more up-to-date things and you haven't heard about it. You haven't read your article for a few weeks and then you could be out of date, right?
That's so true.
Yeah, so you need to be aware of that. That's again going back to the genuality. It's you just have to stick to the truth, exchange the information, and then offer your understanding to your client. I think one advantage our doctors and nurses have is we have fundamental understanding of biological and anatomical knowledge that give us a much better and more comprehensive understanding about the risk and the benefit. So I think that's something you can offer to your patient.
I've actually, even in this conversation, changed the way that I look at the consultation process from more, rather than, educating and sort of dictating, this is what I think you should do, or this is the journey I think you should be on, to shifting more to and listening and a more advisor type role. I love that. I do think patients are more savvy these days. I do think they come in with incredible amounts of information, and you're right. Our industry is so fast paced, it moves so quickly, advancements and changes happen at the drop of a hat, and patients are more, I think, agile and flexible than ever. And I think it's really about listening. I love everything you've said. I think it's a wealth of knowledge and great advice for anybody starting out as well. Can you tell us a little bit about maybe a memorable success story or a case study? What's your favorite kind of journey that you're able to help a patient get through maybe their initial fears and go through a treatment journey with you?
We got quite a few patients. As I mentioned briefly about a patient, who come in to thank me for get her to do some of the service we offer. And I tell you one particular girl, she's now a mother and quite successful in her career and in her family and the relationship. And she is still a patient of mine, in general practice side. And unfortunately, she got quite a lot of acne scars. It's let's face it, it's affecting this young girl a bit. And I went to a dermatology meeting, and one of the leading dermatologists said they did a survey, right, on acne scars. Mm-hmm. If people can identify you with an acne scar, right, it's just like what that means is when they don't know you, but they met you, they said, oh, just that lady or that man with scar, with acne on his face.
Goodness.
And that means they can identify you as that. So that's normally moderate to severe consequences as acne scars. And if you reach that extent without dealing with it, your long-term perspective income on the basis of everything else is equal is 15% less lifelong income.
It's astonishing.
Yeah, that's the reality. That's scientific. That's not someone made up. It's a long-term follow-up. I often sometimes joking with my long-term client, I wouldn't tell my initial patient about that. But when they start to feel comfortable, you're telling them the real truth. I said, look, how many more degrees you got to learn for you to have a lifelong 15% income increase? Can you imagine if you're saving that 15% when you start with your career?
Imagine, yes.
You're
in a very different position.
right. You will have a massive super, all of us. So let's face it, if you have something like that, you have to deal with it. And this skill, every time I do other consultation, I will say, Hannah Antique, do you want to do something about the acne scar, right? And I genuinely believe, she should have some enhancement because she's an energetic, good-looking girl and got a good career. And, in her mid-20s, then one day she come in, she said, okay, you've spoken to me about it for quite a few times. I want to do it now. I said, all right, let's start with one treatment, like a Cynosure Picosure treatment for the acne scar. We started with that. And after the first treatment, she got some improvement. Then she went on to have the whole course, 5 treatment, and she got amazing result. Afterwards, she come in one day. She said, I'm not here for a consultation today. I said, why are you coming? She said, I just want to say thank you because I'm more confident and I got promotion and my relationship has flourished more. And now I'm married. We bought a house together and I contribute part of that, at least part of that, if not all of that, to your advice to me to have this laser treatment because it made me more comfortable about myself and more confident. And miraculously, that just enhanced my attitude in life. And I contribute all my achievement today to partially for your advice. And I really thank you for that. And now she's dragging her mother to come in to have the Picosure treatment. She was happy too. And after 5 treatment, and although a couple of years ago, she had unfortunately been diagnosed with breast cancer, that doesn't mean she should give up this kind of treatment to enhance her appearance and to feel good about herself.
Feel good about herself, absolutely.
Yeah.
And even more so important when you're going through some difficult times in life, when you show some self-care and self-love, it's miraculous the things that can actually happen. Our mind and our bodies are connected in ways that we don't even understand. And I do really think what we do and what you do is a gift to our clients and a gift to people. But I would love to thank you for your time. And I'd love to have you back another day to talk more about lasers, more about skin, and more about all things rejuvenation.
Thank you to invite me on the program. Thank you.
Thank you. You've reached the end of another episode of the ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.